Right now, if you need surgery, someone puts a mask on your face, counts backward from 10, and you wake up with it already done. You feel nothing. You remember nothing. That is, historically speaking, an extremely recent luxury. For most of human history, if you needed something cut out of you, you were wide awake for the whole thing. No mask, no countdown. Just you, a blade, and someone telling you to hold still. So here's the question. What did people actually do about the pain? The answer involves wine, mandrake root, a bullet, and one Scottish surgeon so fast he once achieved a surgery with a 300% mortality rate. Stay for that one. It is real. First, understand the one thing every surgeon before the 1840s agreed on. Speed was the only mercy you were going to get. There was no version of this where it did not hurt. The only variable was how long. That single fact-shaped surgery for thousands of years, ancient Roman military doctors treated wounded soldiers on the battlefield, and one of their go-to tools was opium dissolved in wine. The physician Dioscorides wrote it plainly. Mandrake boiled in wine causes the insensibility of those who are to be cut or cauterized. Mandrake sounds harmless. It is not. The root contains the same family of compounds found in modern anesthesia. It could knock you out. It could also kill you if the surgeon guessed the dose wrong, which, without measuring tools, happened constantly. So the risk was real. Take too little and you feel everything. Take too much and the surgery is the least of your problems. Move to the medieval world, and doctors got more ambitious. There was a recipe literally called the soporific sponge, a rag soaked in a mixture of opium, mandrake, and henbane held under the patient's nose until they went under. It sounds almost modern. Sedatives delivered by inhalation before an operation. The idea was sound. The execution was the problem. No two sponges were the same strength. No two patients absorbed the drugs the same way. And there was no way to check if a patient had actually gone under or just gone quiet. Meanwhile, in China, around the year 200, a physician named Hua Tuo was doing something that sounds almost unbelievable for the era. He developed an herbal anesthetic called mafaison, mixed into wine, and used it to perform actual internal surgery. Historical accounts describe him operating on patients' abdomens while they were unconscious from the mixture. We do not know the exact recipe. The records suggest wine plus a cocktail of herbs. What we do know is that somewhere around 1,800 years ago, someone had already figured out that you could put a person under before cutting them open. The knowledge did not spread, it did not standardize, it just existed in one doctor's hands and mostly died with him. And then there is trepanation, drilling a hole directly into a living human skull. Archaeologists have found trepanned skulls in ancient Peru by the hundreds, some over 1,000 years old. Here is the detail that stops people. Many of those skulls show bone regrowth around the hole. That means the patient survived the surgery, sometimes for years afterward. Someone was awake while a doctor drilled into their head and lived to grow old with the scar. Researchers who studied this believe Peruvian surgeons may have used a fermented corn drink called chicha to relax the patient and possibly the surgeon's own nerves before starting. Not an anesthetic. Just enough alcohol to make a skull drilling slightly more bearable for everyone in the room. By the time you reach the 1700s and 1800s in Europe, medicine had barely improved on any of this. Surgeons had exactly 3 tools against pain. Opium, if you could get it and afford it. Alcohol, if you could stomach enough of it. And a leather strap, or in a pinch, a bullet to bite down on so you did not bite through your own tongue. That third one is not a myth. It is where the phrase comes from. Bite the bullet. Soldiers in the field, with no time for potions, were handed something to clench their jaw around while the surgeon worked. This is the world that produced Robert Liston, a Scottish surgeon working in London in the 1830s, and by every account, the fastest scalpel in the country. Before anesthesia, speed was survival. Less time on the table meant less blood loss, less shock, and less agony. Liston understood this better than anyone alive. His signature amputation, removing an entire leg above the knee, took him roughly 2.5 minutes. His personal record, by some accounts, was 28 seconds. Before every operation, Liston said the same thing to the crowd of medical students gathered to watch. "Time me, gentlemen." He was that confident. He was also, once, catastrophically unlucky. During one leg amputation, moving at full Liston speed, He accidentally sliced off two of his assistant's fingers while swinging back to change instruments. On the same swing, he caught the coat of a spectator standing too close. The man, convinced he had been stabbed, dropped dead from shock on the spot. The patient died of infection days later. So did the assistant. The bystander was already gone. Historians call it the only surgery in recorded history with a 300% mortality rate. One operation, 3 deaths. Nobody touched by Liston's actual blade needed to be. And here is the part that makes it stranger. Liston was not reckless. He was statistically one of the safest surgeons of his era because his speed genuinely saved lives in every other case. This one operation just happened to go down in history for entirely the wrong reason. The end of all of this arrived almost by accident from a dentist. In 1846, in Boston, a dentist demonstrated that a patient could inhale a compound called ether and feel nothing while a tooth was pulled. The idea crossed the Atlantic within weeks. On December 21st, 1846, Robert Liston himself, the fastest knife in the country, performed the first public surgery in Europe using ether. His patient was awake enough afterward to ask when the operation was going to start. It had already happened. Liston's reaction, recorded on the spot, was this: "This Yankee dodge beats mesmerism hollow." The fastest surgeon in Britain had just watched his own greatest skill become obsolete in a single afternoon, and he said so, on the record, without an ounce of ego about it. So, here is the fact we promised. For every year of recorded surgical history, only the last 180 or so involved a patient who could not feel the operation. That means for roughly 99% of the time, humans have been cutting other humans open to save their lives. The person on the table was awake, aware, and simply hoping the surgeon was fast. Time for the verdict. Surgery before anesthesia reviewed honestly. The pain management, wine, root vegetables, and a strap for your teeth. The safety record depends entirely on how fast your particular surgeon happened to be that day. The waiting room experience. You could hear everything happening to the patient before you. Final rating, 1 star. Fleas, at this point, would almost be a relief. Although credit where due. Someone in 2nd century China figured out the answer, then lost it for 1,600 years. Turns out, inventing something once is not the hard part. Keeping it is. And next time on the channel, half of the people you have ever met would have been dead by age 5 in a world without a single vaccine, a single antibiotic, or a single clue what a germ actually was. How anyone made it to adulthood at all. See you then.